So the third speaker is Dr. Jagdish Chinnappa, who is a senior pediatric consultant with 40 years of experience in tertiary care hospitals in India. He did his MD in pediatrics from the Grand Medical College in Mumbai. He's also a specialist with special interest in ethics, pulmonology, and ENT disorders in children. He's the past president of the respiratory chapter of the Indian Academy of Pediatrics, and is the current chairman of pediatrics in the Manipal Hospital in Bangalore. He's on the Institutional Ethics Committee in St. John's Medical College and the Manipal Hospital in Bangalore, and as well as an active member in Indian Academy of Pediatrics. The title of his talk is The Ethical Guidelines for Pediatric Research in India. So, Dr. Chinnappa.
Thank you very much, Professor Chan, for that very nice introduction. Professor Brian, wonderful talk before this, and the organizers of today's meeting. Let me start off by saying that I am a general pediatrician. I have special interests in few things in pediatrics, and I've qualified to some extent in ethics from Kansas. So I am also on the ethics board at a couple of hospitals. This is Bangalore, also known as the Garden City and the Silicon City of India. I come from there, and these are the two institutions that I work with. India, as you know, has a huge population. It's going to be one of the biggest in the world, or has become one of the biggest in the world. And 1/3 of the population are children. So we have a huge child population of almost 430 million children. The infant mortality rate in India was very high, and it's coming down quite significantly to around 26. Still, if you look at Singapore, which is just at 1.4 or 1.5, it's a dramatic requirement there. The major causes of mortality in India are prematurity, primarily neonatal low birth weight, sepsis, pneumonia, diarrhea, non-communicable diseases is increasing now, injuries, and congenital anomalies. So you would agree with me that there's a huge burden of disease, and therefore there are few thrust areas which the public health system is looking at. Neonatal and child health 1, nutrition 2, management of diarrheal and respiratory infections, and immunization. And immunization, we have a very strong immune manufacturing segment because we make most of the vaccines, not only for India but for the world too. Now, to achieve these goals, we have many types of research. Basic research, applied research, and operational research. These are the three main segments through which research takes place. I'll give an example of the rotavirus vaccine, which was introduced in our country. The research started 20 years back by the discovery of the rotavirus strain, the neonatal strain, in the All India Institute of Medical Sciences. And basic research discovered that this virus could prevent further rotaviral infections in children. It was then sent to premier scientific institutions where applied research was done to see that this is translated into a vaccine. And after 20 years, we had the first cheap vaccine costing 60 rupees or $1 per dose. The next thing was to spread it to the entire population, which was applied operational research. So therefore, we have different types of research. Unfortunately, the funding is not very high. We have three sources of funding. The government funding is very, very minimal. Industry-sponsored funding is a large part, and much of the academic studies are self-funded studies. So therefore, it is a challenge to do research in our country. Of course, all research has to go through the same ethical principles. We have been discussing a lot about best interest standards and child rights from morning, and of course, all the other issues are there. How to translate these ethical principles into policy was the basic issue, and we have, of course, robust informed consent, assent and dissent issues. Assessment of risk as far as research is concerned is a very important part of our guidelines. Justice, compensatory and distributive is important, and conflict of interest. Conflict of interest issues are unfortunately not well recognized in many of our research publications. I was very happy that the previous speaker put up the conflict of interest slide, which is nowadays very rarely put up. The Indian Council of Medical Research took upon the onus to see how to put all these principles into practice. And the process started from 1980 onwards. And in 2017 and 2018, we had very robust guidelines which came out from the Indian Council of Medical Research. This has evolved into the ethical guidelines involving medical research for children, and of late, this has progressed further into providing ethical guidelines for the application of artificial intelligence and for DNR, or not to resuscitate. And finally, what has come out this year is on multicentric research. What was happening in India was, when there is multicentric research, each research institute was trying to bring in their own research guidelines. And what the ICMR decided was, for joint multicentric research, they would have a single kind of ethical committee clearance. Now, the ICMR General Guidelines of 2017 had 12 steps. What were these? One was the general principles of research. Second was to deal with benefits, risks, and distributive justice. Third was to define categories of risk. Fourth was a robust thing on how ethics committees should be formed, how to regulate them, how to monitor them. So now the minimum requirement is 5 members of an ethics committee. And this, there is also provision for institutional ethics committee and independent ethics committees. And in fact, even organizations like the Indian Academy of Pediatrics now have got ethics committees for those pediatricians who are not in institutions and who need to do research. Informed consent is very important component there. Vulnerability. India has a huge vulnerable population, and that population is not only children but also the underprivileged and those who are illiterate. So therefore, we need to have separate rules for these vulnerable population. Clinical trial, drugs and devices were a separate group, where I will come to a little later on how the changes took place. Public health research, like for example the Genome Project, there are various projects going on, and there are different guidelines as far as public health research is concerned. Social and behavioral sciences have their unique challenges. Then we had human genetic testing. Here again, for stem cell research and testing and for therapy, there are separate guidelines. Another important guideline which came was on the biological material storage. How long to store, how to store, anonymized, partially anonymized. So various categories were put in there. And much before the pandemic, the humanitarian and emergencies and disaster guidelines had come about. As far as pediatrics is concerned, we had basically 5 principles. What was definition of a child? In India, unfortunately, right from independence, prior to that, there were different definitions of who a child was. And ultimately they said, okay, less than 18 years. Essentiality of the research, type of the study, risk categories, parental consent and assent, safeguard systems. What was very important in this guidelines was how to safeguard the interests of the child during a research process. And finally, looking at compensation for participation and compensation for injury. Risk, I am not going to go into details. This is well known by everybody, that the classification of minimal risk, less than minimal risk, minor increase over minimal risk, and more than minimal risk or high risk. These were the categories that were put in, and it is very, very important in a pediatric research trial to look at what is the risk category. Other guidelines which came about were for unique circumstances. For example, there are guidelines for neonatal research, guidelines for children living with HIV, guidelines for vaccines, because vaccines is a major component of our preventive health system. There are guidelines which tell you how a research for vaccines should be conducted. Internet and telephone based research has its own separate guidelines. We have community based research for guidelines which are there. Adolescents are a separate group and a large group of our population now. So research concerning adolescents is a separate group, genetics and stem cell research, and finally emergency. My previous speaker spoke about MURI, or the monitored emergency use of unregistered and investigational investigations. This was a guideline which came about primarily during COVID. And it was basically because there were a large number of trials with HCQ and other things which are being propagated, and how these were dispelled after trial. Now I will just go through a few of the challenges for meaningful research involving children in India. First is, we have a large population and diverse disease patterns. It's easy to do genetic research in Hong Kong primarily because you have a uniform population. In India, we have such a diverse population with so many races and so much of a genetic pool with consanguinity. So doing this kind of meaningful research is a difficult proposition. The second is, we have quality academic institutions. We have robust guidelines and systems and relatively low cost. If you look at the cost of doing research in India, it's probably 1/10 of anywhere else in the world. And we have a great amount of technical capabilities. These are all the good points that we have. What are the challenges? Funding is a major challenge. Poor health awareness and literacy, language, social and cultural barriers. Third is mobility of populations. Populations move from place to place very frequently in search of job, in search of other things. So doing consistent research on a population is a difficult proposition. Lack of a uniform EMR and documentation. And lastly, I would say inadequate training in research methodologies. I'll just give an example here. This is a boy, a 9-year-old boy with severe hemophilia with circulating antibodies to factor VIII. He is being considered as a subject for a multicentric, multinational industry-sponsored clinical trial. The company has a molecule which has shown promise in phase 3 clinical trials in adults in overcoming the effect of antibodies and prolonging the efficacy of factor VIII. What are the challenges that we encounter in obtaining an informed consent? And what could be the standard operating practices? I'll give you some of the challenges, and these are some, in red are those which are peculiar to India. One was mentioned before is therapeutic misconception. People don't understand the difference between research and treatment. So they believe that treatment equals research. The second is, for any drug trial in India, you need an AV recording. There are robust guidelines on how you should do the AV recording. The problem is, again, illiteracy. Language barriers are there because there are so many languages in India that they may not understand what you're saying. Then coercion and inducement for the trial is important. Medical care and insurance if there is injury from the trial. And finally, who is an impartial witness is another matter which needs to be defined. So as far as the standard operating practices for informed consent are concerned, I'll just give you just this checklist. I'm not going to go through all of them, but there are 27 points in the SOP of an informed consent that we need to fill in for a research project. Okay? So what I'm trying to say is that it's very easy to bypass all this. So in conclusion, research ethics is a double-edged sword. It's always done for the benefit of the child, but there's a risk there. Second is informed consent and assent are very important, but also there is a possibility of inducement and coercion. Shared decision making was spoken about quite a lot, but it's very impractical in India because ultimately most medical care, at least in populations where there's high amount of illiteracy, is paternalistic. The person will say, let the doctor decide. Okay. Adequate compensation is a problem that we need to look at in all our research studies because there is always a scope for exploitation. And we also need to look at what is the larger community benefit and not what the sponsor, investigator benefits. So there could be a conflict of interest. So thank you very much. Namaste.